Okay, so this is going to be the second part of the women's health lecture. So first of all, we're going to talk a little bit about adolescent pregnancy, and you can see the statistics. This is from 2017. This is the latest information, and we are talking about girls between the age of 15 and 19 years old. And you can see that there is a percentage of babies that are born to girls in that age group that already have one child already. So these numbers are decreasing. Every time the statistics come out, they have been on a downward trend. But we still do need to talk about this and talk about how this is a little different than an older woman who is pregnant and having a baby. So the reason why we want to talk about this is we want to talk about the risks that are there for the child and the child. It could be if it's a 14-year-old or a 15-year-old, the pregnant adolescent is still a child. But what we're talking about is there's risks to the infant in utero, there are risks to the infant after birth, and risks to the adolescent girl that is pregnant. And so you can see that there are some physical or physiological risks. Babies may be born preterm. They may be born with a lower birth weight than expected. And this would be because the girl does not receive adequate prenatal care. She may not receive any prenatal care because she is trying to hide the pregnancy from her family and friends. A lot of this really depends on how good a social support system the young girl has when she becomes pregnant. If she feels that she is not going to be supported or accepted when she becomes pregnant, then this would be the situation where she would try to hide it, not receive adequate prenatal care. Cephalopelvic disproportion, this is when the pelvis is just not the right size to accommodate a vaginal birth, and we will see this with our younger girls because they're just not fully grown yet. Preeclampsia, as you remember in the lecture, is more prevalent in our younger and higher aged individuals. And this can be a deadly circumstance if there is no prenatal care. Not to mention psychological, sociologic risks, depending on where she is in her developmental stage. It's an interruption of her life. Is she in school? Does she have to stop going to school to support herself and her baby? Is she going to become dependent on her parents for financial means to take care of her baby, for somewhere to live? What happens with the relationship with the father of the baby? Do they stay together? Is he there to support her emotionally, socially, financially, or does he leave when he finds out that she's pregnant? So depending on her age can affect her social stability, her psychological stability, and her economic stability if she's not able to financially care for herself and her baby. Risk to the child after delivery is just related once again to the support system that is in place. If she is on her own, some families are very supportive. They take their child and grandchild in and provide for them. Some families, I hate to say it, disown their daughter. They kick their daughter out of the house when they find out that she is pregnant, and now she's left to find somewhere to live that is not the best neighborhood for herself, for her child. She isn't able financially to provide for herself and her child. So this can lead to behavior problems as the child grows. It can lead to abuse and neglect. It can lead to that child being placed in foster care because the girl cannot take care of her baby properly. So it places that child at a great risk just because that adolescent girl doesn't have the life skills or the coping skills or the parenting skills or knowledge or the resources to take care of her baby properly. But if she has a great support system, then we will see these children thrive and go to school and be taken care of. So it really does depend on what kind of support system the adolescent has. So nursing management, taking care of a adolescent pregnant girl in the clinic can be kind of difficult. If you remember being a teenager, teenagers think that they know everything. They don't have to listen to anybody. You can't tell me what to do or how to do things. So it's really important to be able to try to develop some type of trusting relationship with them so that they do connect with you, that they do listen to what you tell them. Because once again, in adolescent, when we're teenagers, we think the world revolves around us. It's me. It's what's happening to me. And they tend to not realize that what they do impacts the pregnancy and the developing fetus. So it's important to get a good history, not just a physical history, but also get a history as far as their support systems and their resources. Also, it makes a big difference how old they are in that adolescent stage. Because if you think of somebody who is maybe 14 years old, 15 years old, and this says 14 and under, I have seen a 13-year-old, a 12-year-old come in and have a baby. And they can't even drive. They can't drive themselves to prenatal visits. They can't even get a job. They can't work to support themselves. Their knowledge of a pregnancy or how to manage themselves, keep healthy during a pregnancy, take care of a child afterwards is not there. Okay, if they're in high school, are they going to be able to finish high school? Do they have to drop out of high school? Late adolescent, they've graduated high school. Do they have plans to go to college? Are they going to be able to go to college? Or do they have to not go to college so that they can work and support themselves? So we really need to remember to not only promote their physical well-being during the pregnancy, but their self-esteem, help them develop some of those coping skills, problem-solving skills, because when you have a child, there are a lot of problems that come up that you need to know how to take care of, and you need to know how to take care of them effectively in a way that is supportive for the child and the parent. Okay, and then find a way to, once again, like I said, make sure that they realize that what they do does affect their child in utero. Okay, and so that is the adolescent pregnancy. Okay, so now we're going to just talk about a couple women's health issues. So there are, besides women having babies, there is a time in a woman's life where that is not the focus of her reproductive health. It might be before she decides to have children, like we talked about with the contraception lecture and helping her choose a form of contraception. It may be after she has decided she's done having children. She is now entering maybe that menopausal age. So she's not going to the doctor because she's pregnant. She's going to the doctor to take care of issues related to our health as a woman, because there are some different health issues. And so when she comes to those visits, it may be to an obstetrician who also sees women who are not pregnant. It may be a gynecologist who sees women who are not pregnant. It might be her family doctor or her internist, okay? And so whichever physician, or it might be a nurse practitioner or healthcare provider that is providing this care outside of pregnancy, once again, we need to have a good history and physical. So we need to have a personal conversation with them about their reproductive life, about their contraceptive history. We need to do a good history, a physical history, any other illnesses that she has, any medical conditions that she has. Also, we are going to see women in this area of health from all different backgrounds, cultures, religions. So we need to make sure that we take those into consideration when they come in for this visit, because not only are we going to be talking about personal information, they're also going to have some very personal, private health assessments done. And so there may be certain cultures where they will not accept a male doctor. It has to be a female doctor or a female nurse. There may be considerations as far as removal of clothing, things like that. Women with disabilities, if there are physical disabilities, then we may have to make adaptations to the actual physical exam that will occur during the visit. We should always assess women for any abusive relationships, okay? Adolescents, we talked about, need to be addressed differently. And then our midlife and older women, they'll be coming in for different health issues. As I said, every encounter, every visit should address the issue of abuse. So most histories and physicals do actually have a question that asks a woman if she is the victim of domestic abuse, physical abuse, emotional abuse. It's also very important to watch the nonverbal communication. If her partner comes with her, does her partner come back with her for the exam, for the visit? Does the partner not want to leave her alone? So we need to watch for those types of cues. If you ever have an inkling that maybe there is some type of abuse maybe occurring, maybe it's watching the relationship, maybe it's during the physical exam and you see bruises or marks, then you're probably not going to get an honest answer from the woman if her partner is there, because she's afraid of what would happen when they go home if she actually told somebody. So you can ask the partner to leave the room. You can tell them that they have to leave the room during the exam, okay? And then maybe she might be a little more forthcoming. Sometimes they may not. They may still deny it, okay? And so then you cannot, I'm not real sure if things have changed, but you were not able to report it unless the woman herself wanted to report it, okay? So this is a very sensitive issue, and you really have to abide by her wishes because you could be putting her in harm. So the physical exam is going to be a complete head-to-toe exam. It will include specific exams related to a woman's health, such as the breast, the reproductive tract. A bimanual palpation is also part of assessing the reproductive tract, looking at the vaginal canal, the cervix, and then there are some specific lab and diagnostic procedures that are done. I could never say this word. It's more commonly called the Pap smear, Pap test, so that is specific to a woman's health. Also, depending on her age, they may test thyroid levels for maybe hypothyroidism, cholesterol levels, bone density assessments, glucose, and then of course, women should always, the topic of sexually transmitted infection should be addressed, and the examination of the vaginal canal and the reproductive tract would also look for signs and symptoms of any sexually transmitted infections. So breast health, the breast exam. When the woman comes in for her visit, it may be her annual yearly visit with her doctor. The doctor, the nurse practitioner, will do a breast exam, the woman's breast. So they will palpate the breast to assess for any lumps, any changes in the density of the tissue. Women are also encouraged to perform self breast exams at home. Now, depending on what resource you look at, there are some resources out there that are saying that women probably shouldn't do self breast exams because it may not make a difference. They may not be performing the test properly, adequately enough. They may not notice changes. But there are a lot of sources that say that women should still do self breast exams because then they may notice any changes early, and that could make a big difference in the treatment and the outcome of the disease. So a woman is going to do a self breast exam. She should do it once a month, every month. It should be 1 week after her menstrual period has ended. And she's going to assess both breasts because you want to make sure that both of them are okay. She can do this in the shower. She can do this standing in front of a mirror. She's going to want to visualize them in the mirror first to make sure that the appearance is the same, that there isn't any dimpling. Dimpling that was not there before can indicate a change in the breast tissue. When she actually palpates the breast, she can do it standing up, she can do it lying down. She needs to put that arm up. She takes the opposite hand and she's just going to palpate the tissue. Just touch it. And if she does this once a month on a regular basis, she will become familiar with her breast tissue and she'll be able to notice any changes or lumps that occur. The other key thing when you're teaching a woman to do a self breast exam is to make sure that they go into the tissue under the arm because there is breast tissue that comes over this far, okay? And she should just develop a pattern and she just does it the same way every month, okay? And she'll do both sides. The other very common test of women's health, once I said, is the PAP. This is a test that takes a sample of the cervical tissue inside the cervical canal and the outside the tip of the cervix. And then that tissue is sent away to a lab for testing for any abnormalities or changes in the cervical tissue that might indicate cancer. And so this should be done as part of their exam. And you can see that there's a little brush that is used to collect tissue in the cervical canal. And then there's like this little wooden paddle that takes the tissue from the tip of the cervix. Some instructions, if you're working in the clinic and you are making the appointment for the woman and you know that she's going to have a PAP test done during that, make sure that she knows she should not use any vaginal suppositories or have sexual intercourse for at least 48 hours before the test. And if she is going to have her menstrual period during that time, the PAP smear or the PAP test will not be performed because that just can affect the tissue collection, and so it may not be as accurate. Okay, so this is a list of common screenings that are included in women's health during their lifespan and how often they should be done. The ones that I really want you to focus on and remember is a breast exam. So this clinical exam, this is where a healthcare provider actually palpates and assesses the breast tissue. And that should be done at least every 3 years between these ages. Once a woman turns 40, that increases her risk for breast cancer, so she should have a clinical exam, every year. And then if she's high risk, meaning that there is a history of breast cancer in the family, she should have a clinical breast exam starting at the age of 18. Mammogram is a test, a radiographic test that a woman has, and it takes a picture of the breast tissue. I don't know how to describe it, and I don't want to like TMI too much information, but basically they take the breast and they put it on a plate on a shelf, and then they take this other shelf and they bring it down and they squeeze the tissue in between there and they take pictures of it. Once a woman turns 40, she should have a mammogram every year. Okay. Once she reaches the age of 75, based on her history, she may be allowed to not have mammograms anymore. That would be her physician's decision. A pelvic exam, which is just an assessment of the reproductive system, looking at the vaginal canal. This should begin once a girl or woman becomes sexually active, okay? Because this is where the healthcare provider may be able to detect signs and symptoms of sexually transmitted infections. A Pap test. So the Pap test that we were talking about, whether it is just a plain Pap test, there is also a Pap test that includes the HPV test, which tests for human papillomavirus. Depending on which one they are using depends on how often. There are some physicians that will do a Pap test every year, okay? But this is the current recommendations by the women's health organizations. But if it's done more frequently, that's okay. The minimum is every 3 or every 5 years. And then once you hit the age of 65, if you've not had a history of any abnormal results, then they may stop doing them. Or if you have a total hysterectomy where they remove the uterus and they also remove the cervix, then you would not need a Pap because you wouldn't have any cervical tissue to test. And then the other one here is, remember when we talked about the Depo-Provera contraception which is progesterone based? This would be a woman who definitely should have her bone density assessed. But any woman should have their bone density assessed at least once by the time they are 65 or around 65 years old. Colonoscopy, and then sexually transmitted. So what I want you to really focus, I want you to know about the breast exams, the mammography, the mammo, and then the Pap test. Those are the 3 key ones that I really want you to focus on for our testing. Okay, that's it for the Women's Health lecture.